I want this curved, not your knee up real high and this flat.
Mm-hmm.
You can get louder pops with the knee up real high, so everybody does it. You understand, which makes people happy, but I'm not here to
making me happy.
Make large, well, I am here to make happy, but I'm not here just to make loud pops.
Right.
I'm here to try to bring your spine back into the right alignment, which will make you happy because your spine's gonna last longer.
Yes.
There you go, all right. Yeah. You okay?
Yeah. I'm gonna let that simmer for a second.
Yeah.
I feel like you're about to rub my heart.
It's literally like a water balloon underneath your skin right here.
Yes. Wow, that feels real weird. I just noticed it. It's like not there.
It's gone. And it's gone.
Wow. It's not the dull, like I don't have the dull ache.
Wonderful. And it's gone.
Dr. Ed. That is
I'm
wild.
gonna make this pencil disappear. Pain on the left side.
Yeah, so pretty much just the left side of my body has been kind of junked up lately over the last, like, ever since I got pregnant with Austin. So anytime I'm having issues, so like my neck is kinked up, my eye is twitching, like I have a left eye twitching. Also have like a stopped up ear. But anytime there's, my sciatica is like really messed up. Just anytime there's an issue, it's on the left side of my body.
Now the sciatica, did that start after the second pregnancy?
Yes.
Did you have any before?
A little bit, but lately it's gotten like worse. And then it just got really bad during the pregnancy, and then I still feel it.
Headaches in terms of how often do you have headaches?
I constantly have like kind of a dull, like it's just a dull, low grade headache.
Every day?
Pretty much, yeah.
Okay. And you've told this to other doctors and their responses?
I haven't. I don't see the doctor.
Okay, all right.
I don't know. I mean, I have mentioned it to him, yes.
Okay.
Mm-hmm.
Does he say anything?
Just
No,
pop your neck and...
yeah, he kinda-
Okay. All right. All right, so pain is a call to action. Your body's trying to say something's going on here.
Mm-hmm.
Pregnancy loosens up all the ligaments in your body. That lower back takes obviously a lot of, your body's transforming. The SI joints are under a lot of stress. Typically after pregnancy, the joint below your lower back gets real stiff. That makes the lower back overwork. We want to go in there and remind the joints around your lower back to not quit.
If I'm sitting for too long, then the left side of my body, like my feet will go...
The whole leg.
Yeah, well, not the whole leg, just kind of like from here down.
Okay.
I'll start getting like the numb tingliness, and then same at the tip of my fingers.
And that's been going, both of those have been going on for 1 year?
Since I got pregnant, so it's, I guess, the 9 months and then the year, so almost 2 years.
No MRIs, no x-rays, nobody's ever taken a picture of your neck or back, no imaging at all? Nobody's curious? Okay.
Nobody cares.
Nobody cares! All right, so the numbness is evidence of nerve pressure. At our age, it's the disc. The discs are hitting the nerve, and so it's a pretty serious thing. And so we don't want to, if that's happening, we need to know about it and then do things proactively so that this doesn't progress to, and it's just numb all the time.
I try to go once every month.
Okay, all right. Ben, let me see how you're moving here. Just try to see. How many times do you brush your teeth? How many times? Am I the first person to start brushing in here? Or, what am I running into here? Okay, deep breath in for me. Head back for me. I got you. All the air out. I got you. All right, deep breath in. I got you. Head back. Exhale. All right, deep breath in. There we go. All right. Exhale. So,
Yeah, nothing like that.
Okay. All right. It's not so hard. You're just not good at it. Anyway, so part of what's going on even with your shoulders, maybe you've seen it, the shoulders, when you're pregnant, the chest expands, and then you're not pregnant, and then your body stayed, you understand, in that expanded position. When your baby's growing, it pushes all the ribs up, all your organs go up into your chest, and that all the ribs have to elevate. It is a necessary thing that has to happen, but your body's supposed to go back to ribs back down. If we stay with the ribs up, we call it the thoracic outlet. They're the nerves that leave your lower neck get pinched because the ribs are staying elevated. You ever heard that before, the thoracic outlet, or no? Nothing about these words?
No.
Okay. All right, so there's three components to fixing this. We have to get the ribs down, we got to get the bone in your neck in, and then we have to clean the channel that the nerves are sitting in. So that's how I want to go through that with you a little bit. But that's what's causing the tingling in your arm. If we had to do it, the human race would be over.
Yeah.
Not one guy would do it. And did you see what happened to Phil? It was awful. Guess we're going extinct as a race. No more people being born. Deep breath in for me. Look over the shoulder. There we go. Put your back of your head right here. There we go. There we go. Deep breath in. Exhale. I got you. There we go. Exhale. I got you. There we go. There you go. That's that for me. Good. Beautiful. The lower back's supposed to be curved, right? So why do I want to be bringing the knee up real high, which makes that flat, right? When I adjust you, I want some curve. I keep moving your... See how there's more sway in your back here? I want this curved, not your knee up real high and this flat. You can get louder pops with the knee up real high, so everybody does it. You understand, which makes people happy, but I'm not here to
making me happy.
Make large, well, I am here to make happy, but I'm not here just to make loud pops.
Right.
I'm here to try to bring your spine back into the right alignment, which will make you happy because your spine's gonna last longer.
Yes.
That makes me happy. Take a deep breath in. Exhale. Face that for me, good. Posture creates lactic acid buildup in the muscles. The muscles then are holding on to all this acidity. The nerves are traveling through the muscles. They're irritated. That's what gives you that constant. Even the drainage of your ear, all of that happens down because of tension in your neck. There you go. All right. Yeah, you just need to get that, and then we get on a neck down roll, and there you go. All right. Whoa. Yeah. You okay?
Yeah. I'm gonna let that simmer for a second.
Yeah. He might be working too low on your neck, maybe. He's not up there. He's not up here at the top. We gotta get. Notice my hand was right up off your skull. I'm not down here.
Right.
I'm up. We're trying to loosen. As a patient, it's sometimes hard to perceive. I don't know. I opened my mouth and the guy just started. I don't know what 21 or 22. I don't know. So. You know, I knew that there's numbers to these teeth. I know he's got all the teeth numbered. I was like, you have numbers? Okay, whatever. The top two here, C1 and C2, these two guys they're supposed to be moving up here. And if they're, as a patient, the goal is to adjust this upper neck, but it's like, I don't know, he turned my neck. You can't perceive exactly which vertebrae was moving, but as a practitioner, it's like, no, I'm targeting this area right on your suboccipital area. Nobody has surgery up here. There actually isn't anything to operate on up here. The skull sits on a round donut called your atlas, which sits on a pin called the dens, which is part of C2. And that's how we turn our neck. About 60% of the work is designed to happen at the top two. The first disc is below C2. Okay, so there's no disc between the occiput and C1 and between C1 and C2. There's no discs there. So the discs represent tread. There's only so much tread on the tire, and once you wear out the tread, surgery, right? That's what. So if we have the upper neck working, then the lower neck tread is under a lot less stress and won't age so fast. The tread in the lower neck is what supports the nerves, so you don't pinch nerves and have numbness in your hands. That's the whole point of the tread, is that non-sensitive disc its job is to hold open a hole. As that disc thins out and flattens out, then it doesn't do that job, and then the nerve gets squeezed, your head goes forward. Okay, here we go. All right. Headaches are what we call a referral pain. It's an overlap, basically because we have electricity going through nerves and tracts, and if some of those tracts are close to other tracts, some electricity can jump from one tract to another, just based on wires, right? If you have electricity going down one wire and you bring another wire closer to it, some of that electricity will hop to the other tract.
Speaking of you saying that, like as you're rubbing that, my eye is twitching, my left eyelid is twitching.
Right, well, it's on the same network.
Yeah.
Because this upper neck, so the nerves that leave your upper neck do not go to your face or your eye, right? So it's called trigeminal nerve, right? Trigeminal nerve is the sensation of your face, is cranial nerve 5. So why, Dr. Red, is my upper neck the cause of my facial pain, right? Well, it's because the trigeminal thalamic tract, thalamic means pain, the trigeminal nerve has a tract from your midbrain down your spinal cord that actually goes up down to about C2, C3 in your upper neck. The spinothalamic tract is the pain tract for the skin and the tissue on the neck. Those two tracts happen to be close together in the spinal cord, and electrical overlap. That's what causes headache pain, or what we term tension or cervicogenic headaches, come from inflammation here overlapping with the tracts that go to your face. That took 6 months in school to figure that out. I was like, you should have seen me in school asking, no, so why exactly is there facial pain with...
Yeah, it's always just been like a low dole.
Yeah, you got to get this. It's because of this.
Mm-hmm.
It's called cervicogenic. So muscles of facial expression are cranial nerve 5. Muscles, wait a second, hold on, let me get that correctly. Hold on.
7, right?
7, oops. Yes, sorry, muscles of mastication are 5.
Yeah.
Muscles of facial, good job. You see, I knew it was wrong when I said it, and then thank the Lord the doctor's here to back me up. All right, so.
Another doctor's got your back.
Well, they drill the cranial nerves into us.
Oh, yeah.
Oh man. And it was old, on old Olympus, tiny tops of Finn and German view to hops. You heard that one?
There was a more
What'd you-
risque one that I heard.
Oh, you?
Yeah.
Oh!
So I hope you remember it.
Did you go to the same chiropractic school that your dad went to?
So same, it's both called Palmer, but they have 3 campuses. So I went to a different campus. He went to Palmer, Iowa. I was in Palmer, Florida.
Okay.
Brenda and my brother just graduated Palmer. We both all went to Florida.
So all 3 of you are?
My sister's in Orlando. My brother just
Wow.
graduated in December. All three kids are chiropractors. So there's 4 of us. Yes. Danger. You put us all in one room, man. If there's a body on the table, we pounce on it.
Oh, that's funny.
Just got to clean all this out. It's actually not. Now, obviously, going in here and vacuuming, we're all going to stir it up a little bit. So, it's awake now, right? And then after it dissipates and cleans out, it'll feel better. So don't be disheartened. It's, there is a process to opening up and dilating the tissue. It's like you clean the teeth and then the gums bleed. And it's like, well, the dentist hurt my teeth. No, your unhealthy gums bled when I cleaned them because you haven't, done what you're supposed to be doing. And so there is going to be a level of sometimes inflammation due to me going in here and cleaning. But long term, it's cleaner now. And we're in a better position for the nerve not being upset. But there we go. Yeah, here it
Yeah,
comes.
you can feel it. I
Yeah.
can feel exactly where it is. That is so weird.
Yes, right there. That's the headache. Right there, yeah, that's all.
Yeah, I can really feel that.
And the same device that your husband was on, that neck dental is going to be the way that this is sealed and, allows you to have a tool to care for your own neck and spine. Not just like, what do I do by myself, Ed? It's like, just hold your head upright. Get good. Give me a break. Terrible advice. Is that a cat being strangled? No, it's mine. It's a dog pound? What is that?
It's y'all's second venture.
There'll be comments sometimes, because we used to have the kids here early on all the time, and they'd be like, what is that banshee in the background? And I'm like, those are children.
Yeah.
This is a
This is a family practice, okay? This is real life.
We have some friends that don't have kids, and it's just getting
you can't-
harder and harder to relate to them.
can't
It's
hang
like,
out
what do
with
you do all day? What do you like? Oh, I just read
They
and
have like an encyclopedic knowledge of TV shows and movies and sports, and we're just like,
we have no idea what's even going on in the world.
My kids go to bed, I just like, we'll sit here.
Yeah, exactly. I just want to stare at a wall.
One time we went to Epcot, like first time a couple years ago with our kids, and like got like a drink or something like that, and we just like sitting on that where the big lake is there at Epcot, and we're just like, I'm just sitting there.
Yeah.
I look over at Carl and I'm like, you okay, babe? Okay, I'm just gonna go back over here. I got you, it's okay. There you go. Yeah. So that should have already moved.
Yeah.
Right? That was coercion. I moved, and then so what part of that was the joint moved and then it fully moved, right? There was all this plaque inflammation in there that I had to squeeze out, and then we can finally get a closure of the joint. Now, why do we want to do that? Because when the joints are overlapped, now the muscles, all those tissue can take a break. You got the muscles working on overtime because of the posture, because of the alignment of the vertebrae. We got to get on the neck dental roll. But in order for the dental roll to even be that effective, we have to make sure that we have to get everything to close. We got to get all the joints closed. There it is, a little bit deeper. Yep, same. So we were just talking about how it's easier to breathe with the ribs elevated, but long term it's going to cause pinching of the thoracic outlet, and then the stiffness that the chest is in overstresses the lower back. We want to try to bring these ribs down. I think of it like a kitchen. If you just left all your drawers open and might make it easier to grab something out of it, never shutting the drawer, but now you're bumping into them all the time. So you kind of bump into things, leaving the drawers open, leaving the ribs up. But this is a consequence of 2 pregnancies and having Dr. Ed or Dr. Bo in your life. Let me really push these ribs back down.
Oh.
I know. All right. Right there. Like that's all gotta be. Did somebody put sand in my back end? Oh, that's gotta go down.
Try to get a massage, like every month or so,
Okay.
but I definitely don't.
Not like this.
No.
It's not like this.
She does like a lymphatic, and so it's like real gentle.
Oh, it's a fun. Oh,
This is not a lymphatic.
this guy's trying to go to my spine, man. He's trying to push through me.
Yeah, I feel like you're about to rub my heart.
Believe it or not, I'm good cop. My dad's bad cop. It's like, people will go, I'm not afraid of your father, and I go, ugh, you will be. Man. Yeah, just like even like this right shoulder's like relax. Yep. See what I'm saying? She holds it. You hold. What do we do about it? Well, as soon as possible, we want to bring you back to where you were. When the progesterone levels start dropping, your body, like the clay starts to harden again. And then whatever position it's in is where the clay hardens it. And then the longer it's hardened, the harder it is to re-soften the clay back up again, to reshape it again, and unless you get pregnant again. And I've done that many times I've had many patients get pregnant again, and then it's easier to change them, right? This rigidity right here, this is all what makes the lower back and hips hurt. Just, how would you... Yeah, that's not...
Was his like that? Did his feel like that?
On his left side, his ribs, the ribs were like that, but you have it more on the vertebrae.
Ooh,
Yeah.
yay.
Transformers and robots, and it's just a transformation. This is...
Oh, man.
Mm-hmm. That's part of why the hands are going numb, is because this isn't down.
Yeah,
This is supposed to be...
I'm feeling that, like when you rub that, I'm feeling that go all the way down.
Yeah, I know. This is the thoracic outlet. Part of the impingement is because of this not resetting back home. That's why pregnancy altered this, and pregnancy alterations. Like I said earlier before you got here, this is why she's going to get a Mother's Day card the rest of her life. Thank you, Mom. Thank you for sacrificing your body.
So I was telling your wife that
Yes.
once I got into the diet stuff, I started getting into looking into chiropractors because I was reading about the small intestine and the spine and everything.
Yes.
And, I hadn't had a normal menstrual cycle ever in my whole life,
Right.
and I went to see a chiropractor for the first time. My mom was like, don't do it, blah, 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 it's dangerous. And within 30 minutes, I had my menstrual cycle started. Like, what are the chances of that?
Your organs, right. The brain communicates intelligence through nerves that leave your spine and 12 cranial nerves. And mainly the vagus nerve, cranial nerve 10 is what, they call vagus means vagrant, which means wanderer. It kind of goes all over the place, and it's your parasympathetic control. But the sympathetic control comes from your back, and the yin and the yang, and the balancing of those two systems is what controls organ function. And they don't connect the dots from organ dysfunction from nerve, signals not being properly received.
Mm-hmm.
That's where we are. Yeah, a lot of marks back here. This is what's causing this stiffness up here. Is what allows your lower back to be under too much stress. Yeah, right in there. Ooh.
I feel that evil leaving.
Yeah, what is it? Yeah, right. Look at that. I mean, it's literally like a water balloon underneath your skin right here.
Yes. Wow, that feels real weird.
I know.
Oh, I'm starting to sweat a little.
Oh. All right.
Oh my gosh. Wow.
That's all
I could feel all that
That's like that water
too.
balloon.
Yeah, wow.
Get it out of there. I know. There we go. There we go. There we go. All right. I didn't know all those back there, Ed. All this.
Yeah,
all
golly,
that.
it feels like a million lumps.
Mm. Oh, man. All right. This joint gets even though there were C-sections, this joint still gets stretched out a lot, injured. All right.
Holy.
All right. It's the joint there. It's the joint. It's the largest joint in the body. Right there's the joint.
Yay, man.
That's what we're trying to adjust on your side. That's hopefully the goal when they're adjusting you is to loosen, not let this joint lock down, and then that throws the work down to your lower back. Okay. There we go.
Yeah, being raised
Ooh.
by a chiropractor and then not going through all that. That's
I live in a world where I've been the only person brushing my teeth my whole life.
okay. This is the ear that's kind of stopped up.
When you say stop up, you feel like there's fluid.
Yeah.
So that all drains down your neck, and that is involved with all that tightness in your neck. As we get you on this neck dental and get your neck moving properly, that should all start to drain.
Okay.
Check this too. All right. Go ahead and tilt your head to the right for me a little bit. Tilt your head right. There we go.
Ooh, I felt that.
All right, go ahead and tilt your head to the right for me. Okay, good. All right, go ahead and tilt your head left. There we go. There we go. All right, go ahead and tilt to the left. You're a good sport.
Yeah.
Let me check your shoulder. I actually want to check this right here. So put your hand on your hip for me. And then I'm going to try to get these shoulders back a little bit. So press back with your elbow into my elbow. Press back. There you go. Put your other arm on there for me. And then press back right here. There you go. Good. All right, let me come right over here for me. That headache right now, how's it feeling? Still humming?
No, I just noticed it. It's like not there.
It's gone. And it's gone.
Wow. It's not the dull, like I don't have the dull ache.
Wonderful. And it's gone.
Dr. Ed. That is
I'm
wild.
going to make this pencil disappear.
That's a headache, though.
That guy definitely had a headache now. Woo!
When you did the adjustment, like
Yes.
where you had like rubbed for a while and then
Yeah.
you adjusted,
Got a little
I
deeper.
felt
Mhm.
something. It felt like energy just moved down my
Yes,
shoulders.
yes.
That's what it felt like. That was
Yeah.
the headache. Must have been when it left.
Come here, my little child. This is Chuck.
Hi, Baba.
He's going to be your chiropractor
Oh
in
goodness.
about 20 years.